panel presentation on our first day of our Safety Expo that is happening this week in the Cypress Health region. To all of you out in telehealth land, welcome. We're very privileged and pleased to be able to send and have you listen to our patients here, our patient family reps here, and share their journeys with us. Part of patient safety is when we talk about the safety that we have for both our patients and our clients, and we also look at the safety for our staff. We know that that always doesn't come out to the way we want it to be, and that in actual fact some people are harmed. So as we listen to our panel today, they'll be telling you some good things within our system that's happened to them, and some not good things that have happened to them or their loved ones within the system. And from that, we will take a tremendous amount of learning away, and we thank them very much for coming on a journey with us, where we are listening and working with our patient and family reps to make it better for their loved ones, our loved ones, and ourselves, and other patients that enter into our system. So with that, I'm going to turn it over to Susan, and she's going to introduce the panel. Thank you.
Thank you so much for either coming back or joining us this afternoon. This presentation is going to be a repeat performance from this morning. So for those of you that I have not met or have just met, I'm Susan Stolson. I'm the Director of Quality Care and Patient Safety for the Cypress Health Region. Patient panel, it provides the audience with a snapshot of a patient's or family member's personal experiences within the healthcare system. Sometimes telling a story is a doorway into someone else's personal space. We need to respect that space. You may be able to relate to these stories or on a personal level, or know someone who has had a similar instance. Whether it's positive or negative, the story, we can gain so much by listening and understanding how our patients and families have been impacted. Our hope is you will be able to take away one small piece of something you hear today. Nothing about me without me. This statement captures how the voice of the patient has evolved and has taken healthcare from a model of care to where it is directed or chosen by a healthcare provider to one where the patients and the family members direct their healthcare. One part of my role is to coordinate patient family-centered care. PFCC as it's commonly known. You may be asking yourself, what is PFCC? The definition defined by the Institute for Patient and Family-Centered Care is an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships among healthcare providers, patients, and families. It redefines the relationship in healthcare. That's a big statement. Simply, it is patients, families, and care providers supporting each other so that informed decisions can be made. I find myself fortunate to be able to listen to patients and their family members on a daily basis. It may be as simple as navigating them through the system, connecting them with a program area, or it may be a case that I am arranging a family case conference. The satisfaction one gets by being able to help someone work through the questions or concerns, connect them with the right program area, or advocate on their behalf is truly satisfying. We as healthcare providers, whether we are frontline providers, administration, support staff, all need to embrace the knowledge that our patients and families have. They truly are the most educated on their own health or their loved one's health. We're extremely fortunate to have present with us today Mallory Keller from the Healthcare Quality Council. Mallory is the provincial lead for patient and family-centered care. Mallory brings with her years of knowledge and experiences on the core values, concepts, and principles of PFCC. I want to personally thank Mallory for all her guidance, provincially as well as with this event. I couldn't have facilitated this without her input. Now the exciting part is to introduce to you the patient representatives who have agreed to participate on this patient panel. This is our second. We had one earlier today, and it is truly humbling as well as honor that they have agreed to share their stories with us. Stacy Peters, Myrna Gale, and Angela Mizika. Before we get started with the panel, I'll ask each of you to introduce yourselves and briefly go over the getting to know you biography. And if we just take a couple minutes and then we can start with the panel.
Stacey, would you start, please?
I'm Stacy Peters. I'm from Shamrock. I became a rep after I was approached by my nurse practitioner in Hodgeville. She thought I'd be a good fit for the program. I really enjoy it. I'm fairly new at it, but I do enjoy it. And one of the questions was, what advice would you give someone considering becoming a PFCC rep? And my view is to be open-minded. A lot of times you come with a specific personal or family issue, but you want to improve your situation by being aware of other topics and realize that they're as equally important as your own.
Thank you.
All right, so good afternoon. My name is Angela Mizika, and I am here as the mother of a teenage son. I ended up becoming a PFCC rep in that I was having some frustrations with care we received in the mental health and addictions program. I also work here in the region, so it's been I've had some other challenges with getting what I needed and being able to share that information with the right people. So I had gone to Beth Vachon and she asked if I would share my patient story with the mental health and addictions teams. So I agreed, and that's where this journey began. One of the questions was, what is my biggest fear in being a PFCC rep? I think for me, the biggest fear is that my story is so private, or has been extremely private up till now, and it was really hard to be vulnerable around the people that I work with.
Thank you.
Hi, my name's Myrna Gale. I'm from Hodgeville. And like you, frustration really at my wit's end is what got me to PFCC. And I wouldn't have actually got there if my friend Susan hadn't called me that day and got the lowdown on what my last 2 or 3 weeks had been, making phone calls and just going around in circles and absolutely getting nowhere. My husband was diagnosed with ALS, and I was looking for help. I didn't know where to look, didn't know where to go, other than, what we were told what he had. They basically said there's nothing for you. Well, there had to be something. So Susan called me and kind of directed me and through the right channels and kind of got me going on the right page. And then just in conversation, had asked if I would want to share my story and be a rep, and I said yeah. Not knowing how much time I always have to be a part of this team, but I really enjoy it because biggest thing for me is I feel like I'm making a difference, and I am about that. Now at the age in my life, I for the rest of my life, I want to do productive things that I can be proud of, and if I can make a small impact on that, then that's a great thing. So it's a great thing to be on. Thanks.
Thank you so much. So my role today is to facilitate the panel. I hope that many of you take some notes of what I am doing, because I would encourage all of you as healthcare providers and staff to ask similar questions of patients and families that you encounter on a daily basis. It doesn't have to be a facilitated panel for us to learn from the patients and families that we work with every day. So feel free to jot down the questions and beg, borrow, and steal them, adapt them for your healthcare setting, and really try to listen to the patient-family stories and make small improvements every day that help us to provide safe and quality care. So with that, Myrna, we're going to start with our first question. Can you share an experience where you encountered exceptional care and explain to us what made it exceptional?
Okay, we got a time limit, right?
We've got a time limit.
Okay, so I don't know if any of you have heard me talk before, but I'll say the same thing. You have to follow me like that kids game, connect the dots, because I kind of go all over the place. So you guys got to put the pieces together. I know where I'm at, but you guys might not. So an experience and exceptional care. My husband and I came across an accident, and he had ALS, and we were doctoring in Calgary. We came across an accident, and my husband helped. It was just kind of ironic. That young man was brought to Swift Current, then further to Regina, and how the connection came. His parents came from Quebec, and it's kind of a long story, but they did get a hold of me. They did get hold of me and ask some questions of me, and there was a bit of a language barrier, although they thought their English was really well, and they wanted some answers. And I made a decision to help them, to go pick them up from Regina, take them to the site, pick up their son's belongings. He had passed away, and they had asked for their records. And I don't work in the health region at all, and I know nothing about that. So again, I phoned Susan, and not being able to give that, she went the extra mile and set up appointment for them to come, and the staff would explain, what the details were of their son while he was here for that short amount of time. So patiently she waited, because I think it was 3 different times she had called. We had set up 3 different times in that day. The family, the mom and the dad, were just taking a bit longer at the scene, and a bit longer taking those things, picking their son's things up. So when we finally did get back, I think it was 7:30 or 8 o'clock, and we came to the hospital, and they had understood from Regina some things that didn't make sense to me, but there was a language barrier, and again, I don't work in the healthcare, so when the staff was sitting with them and explaining to them what did take place here, they felt their son, they felt they were told their son had had a heart attack, and he did not. So he was a young, strong man that was in a bad car accident that didn't make it. And so they took the time, and they were so kind and so gentle with them, and explained everything that they did from the time their son got here till the time their son was shipped on, that there was nothing more they could do for him here. That the dad looked at me, and and he said, "We can go. Our time here is done. This is now finished." So, and I wanted to do that because if I had a son in Quebec and that happened to him there would be a language barrier for me, But leaving here, I felt really, really proud that they did that they went the extra mile for this couple, and they will not forget that ever. They keep in touch with me, and they phone, and when we walked out of this hospital, they turned around and they had a good look at it, and they called them the angels, and this other little piece in French, which I don't know what it was, but they called them angels here. So they were very thankful. So that would be an experience of PFCC, stepping out of that little box and going the extra mile.
That's a great story. I think it really explains, how respect and dignity is sometimes not just respect and dignity at the bedside. It's respect and dignity for the family, for the entire experience that they are going through. So, it doesn't stop when the care stopped for that young boy. Rather, it stopped when the family had all of their needs met. So, congratulations, and thank you, Susan, for doing such great work. I think that really shows, and the whole Cypress team for a great example. Alrighty, Stacey, I'm going to ask you the same question. So, share an experience where you encountered exceptional care, and what made it exceptional.
Well, it's a personal story. I am a type 1 diabetic, and so feet care are very important. And I had a persistent wart that we tried to treat here, and that was kind of the good and the bad of it, because we did the treatments which were very painful for over 2 years. And on second thought, I should have insisted on being referred a lot quicker than I was. But I did get referred to Regina, and I had this feeling, so I made arrangements with work. I said, I don't know what's going to happen, so if he happens to do the work, is that okay? And they said, oh yeah, you know, my boss is really good. So I get to Regina, and sure enough, the doctor there does the surgery, and it ended up, I had pretty much my whole heel was an open wound. So I had to have daily dressing changes, and it happened that my nurse practitioner wasn't in Hodgeville. She happened to go away for holidays for a little bit. So I live in the Five Hills, and I work in Cypress. So when I was at home, because I was off for 6 weeks, I went down to Gravelburg, and they were just so good. They would do the dressings. They had a certain dressing that they wanted to use, Regina wanted me to use, and they got that in, they gave it to me so I could take it to Hodgeville, and they were just so good because it didn't matter where I went, I just had exceptional care, and I was very grateful for that because of the needing to take care of my feet. So.
Absolutely, that's a great story that shows, you know, we often have these regional boundaries. You know, we have Five Hills Health Region, we have Cypress Health Region, Saskatoon Health Region, Regina, but patients don't see the regions. Patients are patients, and they come to a healthcare facility. They don't care which boundary they're in. They need the care, and they need there to be consistency, and that the teams can work together. So I'm glad to hear that that worked well for you between the two health regions. Angela, I want to change the tone a little. I'm going to have you share an experience that could have gone better.
So my experience involves my family. My son was in need of care from mental health and addictions as a result of a life-altering experience. Sorry. And I definitely had to run around trying to get him the care that he needed. Thank you. In trying to access mental health and addictions, I had to backdoor our way into the system by contacting the director of care at that time, the director of mental health, because I really didn't know how to access what we needed. It was a very sensitive situation, and again, being staff makes it tough because these are people that I work with every day, and I don't want to have to explain my situation all the time. So in order to get him the care we needed, we were able to do that. But I had a real runaround in getting him appointments for what he needed. So, for example, he's a teenage boy, he goes to school, I work. How could I possibly get him to appointments at 2 in the afternoon? I was pulling him out of school at 1:30, taking him to the appointment. If they were running late, he would get back to school as school was finished for the day. I was having to take time from work, constantly getting, it was really difficult, and he needed these treatments or these appointments once a week. So I had asked mental health if they could possibly see him at the school to give him what he needed to have his appointments, and they agreed. So about 2 weeks later, I got a phone call from the school saying, oh, we're sorry, we actually don't. The counselor head at the time, she said, I don't actually go to the comp. I'm here at Irwin, and I can't go across to the comp, so I can't see him there. So we had waited 2 weeks, and now suddenly I couldn't get the care for him that he needed. So it was really frustrating in that I always seemed to be having a runaround to get what he needed. The other part of it is, being that I work in the region, being that this is a really sensitive issue, we had a sealed file. Our care has gone through multiple providers now just because of change in staffing and so forth. So I know that our file has been reviewed by more people than I would probably feel comfortable with in sharing the details of our situation. When I wasn't satisfied with what we were getting, I did contact Saskatoon and Regina Health Region looking for more specialized services for him, and I was told because we didn't live in those regions, I couldn't actually access that care. So again, those borders were put up right away, which was really frustrating because I know that there's specialized care that I wanted to get for him and I wasn't getting what I needed here. And don't get me wrong, the care that was provided, when it was provided, has been phenomenal, but it's just accessing it and having it regularly enough and those sorts of things. So I think in making the experience better, we need to start looking at how do we break down those barriers. Just because I live in Cypress doesn't mean I shouldn't be able to access what's in Regina or Saskatoon. And we really need to look at the needs of the patient. Again, I am a person who works in the system and understands how to navigate through it. I have some flexibility in my role and then I can say to my boss, hey, is it okay if I leave for an hour and work an hour later tonight? If I was a mom that didn't have those resources or that type of a job, how could I actually get my son what he needed? And even with that flexibility, I still had barriers. So I can't imagine those other people in the system that can't do that. So we need to look at how do we provide care during the time that people actually need the care, when the crisis has actually happened, and how do we ensure that we are meeting the needs all the way around for those people and their families.
Thank you so much, Stacey. You speak to words that are very close to my heart because I think that I too have a patient story, and when you are a part of the healthcare system, you're a staff working in healthcare, you know more about the healthcare system than the average individual. You have colleagues and friends that you can, nudge and get additional supports. Whenever I went to the hospital in my hometown, I knew I was receiving the best of the best of the best care because my mother worked there. And so, you do kind of have those ins that other people don't. And it does make me very empathetic and aware that there are vulnerable people out there who don't have education, who don't have the same language skills that we do, that can't express and get services the same way that you and I could. So, we are all privileged in that we have these opportunities, but not everyone has those. So how do we break down the barriers and use our voice to support those who can't necessarily speak up? Great points. So Myrna, you're next. So safety has been a key priority of work for many of the patient family advisors in Cypress. That's why we're here this week as part of the Safety Expo. Explain what makes you feel safe as a patient or as a family member of patients.
Okay, just recently I had an experience, and so that's what I'll share with everybody, but I do love safety. I'm probably the odd duck that loves OH&S, but I do. Actually, being on PFCC, and I never gave it a thought until the nurse confirmed what I was saying, and then I went, oh wow, they really did do that. They really did. So it's a positive story. 4 weeks ago, I had knee surgery, both my knees, and I had. I was originally going to get them both done, and when I got my pre-op or whatever, the one lady doctor that was filling in suggested just my husband has ALS, and maybe that's a bit much, go with one, and I agreed. I thought, yeah, maybe that is right, So I phoned the doctor in Saskatoon and left a message there saying, I've changed my mind, I'm still getting one, but I'm not getting the other done. So I came in, and when I checked in, the check-in nurse went through everything with me. Are you getting two done? And I went, no. Explained that whole story to her. This is why, just one. Which one? The right one. Okay? So then they bring me to my bed. Then another nurse comes in, goes through some more information. I'm thinking, holy cow, let's just get this show on the road, right? Like, I just want it done and out. But they did it all again, and she asked me again. Are you getting one knee? Both? No, I'm just getting one. I explained it to them, and even said that to her. I explained it to that lady out there, and she goes, yeah. And then the doctor came in, talked to me about it, and said, it's your call, but the downtime is the same, recovery time is the same. The difference here is you're going to end up in here again after waiting X amount of months, however long that's going to take, and you're going to get put out again. So then it was, yeah, right. Okay, I'm getting both done. Now we're going to get both done. And he said, are you sure? And he asked me 2 times if I was sure on that decision. I went, yes, I'm sure. I'm getting both knees done. So he leaves. Then the nurse comes back in the room, and it really is like that game of dots when you're talking with me or associating with me. That's what the nurses must have thought. But she come back in the room and she questioned me, and I said, okay, you know the first, and I explained the second part of the story twice to her. She left, she came back. And then she said to me, yeah, we're just double checking to make sure. And she looked on my knees. He had marked X on both my knees, and not until that point when she left the room did I even think about safety. I just went, okay, let's get this done. I have to go. I got stuff to do. You know, I got to get home. That's all I was thinking. Let's get this yucky thing out of the way, and then I'll be better. You know, and then I thought, no, they took every precaution. It was like checking your name, and when they come to get you in the surgery room, checking your name. You know, so yeah, that made me feel really safe. To be honest, everybody hears, you know, horror stories, no matter Saskatoon, Regina, Herbert, Gravelbourg, wherever, and I've heard them too. But it made me feel really safe going under the gun there with that. So that's my safety story.
Excellent.
Yeah.
I think there's a hidden message there that you didn't speak about, and I'm just going to highlight it because patient-family-centered care has 4 pillars: respect and dignity, information sharing, participation, and collaboration. And your story really spoke to a lot of those because you were collaborated with, you were informed and able to make your own decision, which showed respect. They respected your decision, whether it was 1 or 2, and they treated you with dignity in the sense that you had the time to make the decision and think through it while they were present. So, you know, really that was such a all-encompassing story. They really were educating and engaging you in your care. So I'm glad. I mean,
Actually, I'm going to add one thing to that because this is really important. The next morning I got a phone call from the hospital. And instantly, if you guys know my mind, I'm thinking they probably left a tool or something in there that I had to go back. Because why would they be phoning me? But they were phoning me to see if I was okay. That's it. And I went, really? Like I couldn't believe that they were doing that. I've never had that done. So that was just reaffirming everything. Yeah.
And they were closing the loop.
Yeah.
That's excellent. Thank you so much for sharing that. So, Angela, you are a patient-family advisor. You're also a staff person. That's kind of a dual role. Usually patient-family advisors aren't staff, but given the dynamic that you kind of talked about, you know, you experienced things that were challenging even though you were working your internal relationships. And so tell me a little bit about what it's like to be a patient-family advisor and how you find it rewarding.
So I think for me, this actually kind of happened to me accidentally, I would say, in that as part of the work we're doing here in the region, a big focus is on mental health and addictions wait times. And I've had opportunity to work with that team to talk about ideas for how we would improve those wait times. So in the midst of all of that, our CEO had asked if I would share my patient story because she knew my frustrations. And sometimes from that team perspective, they're not always thinking about it from that patient perspective. So when I went in to share my story with the team, I have to admit I was scared because I didn't really know what their reaction would be because I am somebody that works with them and they're like, oh yeah, here comes Ange again with all her improvement ideas, right? She's gonna be, so when I did share my story, and it was the first time I had been able to do it, when I saw the looks on their faces, it totally made me realize that they didn't see the whole picture from that patient perspective. They know their own little pieces of work, but I don't think that they really understood the whole big picture and what happens. So when I saw that impact, the impact that it had to share my experience with them and the looks that they had, it made me realize how important that this is, that they know what the patient's experience really is. We all say, oh yeah, we're patients, but in seeing how my story affected them made me realize why we need to actually be, somebody needs to be working with those teams that actually has been through those experiences. So for me, the rewarding part was that my story, as bad as it is, or as uncomfortable it is for me to talk about, really can have impact on them wanting to make changes. And I think to me that was the most rewarding part, and it makes me want to be involved even more. So I know part of it is in our region we've talked about, there are staff that want to be involved as PFCC reps. And so how do we do that? Because really as a PFCC, I'm a volunteer, I'm not there to be paid. So I've said to that team, if you are doing improvement events or whatever, let me know. I'll take time off work to be able to participate. That's what I can do to be able to make the system better. And so yeah, that's the most rewarding part for me.
Yeah, I think it's definitely a challenge, right? When you are a staff person and you're having personal experiences, but recognizing that you have a bit of that bias, you have a bit of system knowledge, but also trying to take that hat off and still represent the true experience. You can speak to a lot of things that, you know, a staff person wouldn't necessarily think about, like scheduling and accessibility and coordination of appointments and you know, new terminology, new words that you might not be aware of. You can provide a lot of insight into that, which from the staff experience, you never know truly, and no matter what business you're in, what your customer really experiences. And that's really what it is looking at through our patient's eyes, what are they really experiencing?
If I can add to, I think the other part of it is knowing that so often we hear, when we work with teams, we'll hear them say, we can't do that, but coming in with the lens that I have, knowing that, hey, we can do that. There is nothing that we can't do. It might just be really hard, but we need to look at how we do things differently. So not taking we can't do that as an answer.
Sure. Yeah. For sure. We can't get hung up on the word can't. Exactly. Keep moving forward. Alrighty, so Stacey, you're next. What is one thing that you think is important for the healthcare teams to do to become more patient and family centered?
I think the biggest thing is to listen to the patient or the family rep, and not assume that the family member's just demanding the impossible or don't know what they're talking about. I've had situations, like I take very pride in knowing that I look after myself, and I know what medications I'm on because I have multiple things wrong. And I've had a physician that didn't listen to me, and I dropped that physician. I said, no, you know, you're not listening to me. I don't want to be here. And from that physician, I went to another one, and that one listened to me, and it ended up being something totally different than what we thought it was in the first place. But he referred me to another physician, which was a specialist, and they found out the problem. But if I'd have stayed with that other one, I would have never gotten any satisfaction of it. And I've had medications that are wrong, and I have questioned it because I don't take anything unless I know what I'm doing. And it was just a mix-up in interpreting the physician's prescription and to the pharmacist what he thought. So, and they were very good. You know, they thanked me for doing that, because it could have been something that would have hurt me. So I think the biggest thing is to have a communication that they listen. That's the biggest thing, that they listen.
Absolutely, communication is so critical, especially with chronic conditions, because it can be so complex and it's years and years in the making. You can't give a brief history in 30 seconds. You can't share everything and you can't remember everything, but if you're part of the care team and treated equally and have that voice to speak up when you think something isn't quite right, that's the best case scenario for both yourself and for the healthcare system, because we don't want errors. We want our patients and families to be safe. So keep doing that. That's something for us all to learn from you today. So Myrna, back to you. What is one project that you've worked on that you think helped to improve care for other patients and families?
The project that comes to mind would be the front entrance of the hospital. We have a brand new, beautiful hospital, and you're never going to please everybody. And, you know, I'm sure, you know, most of you heard some rumblings. I heard white elephant. That's what I heard. So when there was money donated, and excuse me, Susan had asked if I wanted to be a part of that, and I said yeah. And so listening, I did not attend every meeting, and obviously it goes a little bit further. I just didn't build it, you know, or design it myself. It went further than that. But the reasons for it were it was a beautiful hospital without it, but it just added more to it, and it provided patients, sick people, family, staff, a bit of a walkway to stay out of the elements. If it's raining or 100-mile-an-hour winds or snowing or cold, yeah, it protected them from that and made it easier to get to the front or check in wherever they're going, blood work, whatever they're doing, with that little bit of coverage. So
that's the front corridor where you walk into the hospital.
Mhm.
It's glassed in all the way to almost the sidewalk where you can be dropped in, and you're almost inside within a step or two.
Yeah.
Okay.
And everybody has different ideas about things. Like, but the thing about it is you come to agree. And if you don't understand that, which I didn't, I don't understand all the building things of that, but I thought it should be grandiose and bigger and, you know, go right out to the way, I don't know, cars could drive through. Because that's just how I like to think, big, everything, you know. I'd like a bigger house, more money. But you know what was really good about that was it was explained to me why this is the way and then it makes sense, because you don't know everything, but you're learning it with them and you're working together as a team, you know. And it did provide exactly what every single person wants, probably not, but it provided that, a corridor to walk in, so be free of the elements. Yeah,
it's a great explanation of, you know, why patients and families should be involved in the design of facilities. You know, we come running in from our car or what have you as a staff person, but we're wearing our jacket or our mitts and our hats in the winter. But when you're a patient and you're sick in the middle of the night, you're coming in maybe in a jacket and your nightgown or whatever clothes you could kind of throw on in your moment of weakness. And so being able to come into the corridor that is warm and wait for your loved ones to come in, you know, they park the car and then they come in and get into the facility. We don't think about that as staff as much as, you know, our patients and families definitely would be very aware of how brutal that experience can be in Saskatchewan's frigid winters. And we're going to go back to Angela now. So what is one idea you have for improving the Cypress Health region?
One.
Oh, I'm teasing.
Well, you're stopping me at one. So I think one idea I have for how we improve things is really thinking about how we need to involve patients and families in everything that we do. I think we have a really good start in the organization with including PFCC reps in a lot of the projects that we work with. Anytime we're doing any of the lean work with the rapid process improvement workshops. But I think we need to look beyond that as well. Those are structured means that we know we need to involve PFCC with, but really we need to start listening more intently to what our patients and their families are actually telling us. Like I said earlier, we all, you know, I've heard the comment from staff so often, yeah, we're all patients in the system. We are patients in the system, but I truly didn't understand how mental health worked until I had to use that service. I would have had a totally different idea of what needed to be done to make it better than actually going through the system and understanding what the broken pieces were. So I think we really need to take that into consideration, as well as when we're asking people to participate, making sure that they have that knowledge and have been part of that service to be able to really tell us what the improvements need to be. I know in some of the work that we've done in the past, we're happy to have somebody involved from PFCC. I mean, we're so thrilled that people can be a part of that, but we really need to think about who has not received what they needed, how do we get them involved, and how do we listen to their voice, and that they're not a token member of our teams, that we're really listening, because they, I mean, honestly, once you have those experiences, you have a pretty good idea of what needs to be done to make it better. So it doesn't matter what we do, we need to be involving the voice of the patient.
I think you speak to a really big point provincially. We really try to ensure that we had a patient family advisor involved in every lean event, but we need to push past that. So here in Cypress Health Region, we have the steering committee where patients and families come together on a continuous basis to really talk about how you're going to advance the pillars of patient-family-centered care, but also the best practices that go along with that. That also needs to continue down to the bedside or the program areas. And so how do you engage patients and families? It can be in acute care, in long-term care, in community care. It can be every day. As a nurse or a social worker, OT, PT, it doesn't matter. Asking those questions, have you received all the care that you need for today? Is there anything else we can provide for you? And ensuring that we're closing the loop on every relationship, every person's needs continuously, will get us to the point where we do see those little opportunities for improvement. We don't have to have an RPIW, Rapid Process Improvement Workshop, or other lean event or other improvement event for every little thing. Some of these things are just do-its that we can do every day. So it does take all of us having that lens of, let's ask each patient and family every day and embed them in our quality improvement work. So good point. Alrighty, Stacey, going back to you, same question. What is one idea you have for improving care in Cypress Health Region?
Mine is sort of a provincial, but I'd like to have patients' records to be accessible to any hospital, doctor, pharmacy, without the need to get things transferred. I was in a situation recently where I'd left my insulin at home and I was in Moose Jaw, and it took over half an hour for me to get the prescription, and I needed it. If they could have just brought up my name and used one of my refills, it would have been much easier for me. I wasn't in a desperate situation, but I could have been. And it ended up, it happened to me again. And I thought, oh no, not again. And it happened in Swift Current. And I went to a pharmacy in Swift Current, and the pharmacist there said, oh, I can just do it. I can give you a prescription just under my name. And it was like 10 minutes. And it was done, whereas the other place I was in, they had to phone my pharmacy, and that can be difficult because it's a small town pharmacy that has odd hours, and so I just thought it would be nice if they could just look me up. I know privacy, are issues and things like that, but for me, if they could just look me up and give me what I needed.
Absolutely. You must know me better than just a few hours, because this is something I've talked about for years, that electronic health records, patient records, having the patient have access to their record, these are all things that our American colleagues are becoming more and more advanced at, and I really look forward to the day that we're able to have an electronic health record that follows us across the province, but also across the nation. Everything else can be brought up on our iPhones these days, but for some reason our healthcare hasn't quite been able to get there. So I will be right there in stride with you advocating for that access. So I want to give you the opportunity to answer that question as well, because we have some time. So what's one idea you have for improving care in Cypress?
Okay, can I just add to what Stacey said? I agree with that too. And I do believe that would help everybody with their own health care. Like, how do I know or remember what happened to me when I was 5 or 10? Is that all still in there? Like, I wouldn't even have a clue, is it? It's not in there when I was 5 because I'm over the hill kind of thing. Okay, so I should remember. But then again, you're over 50, so you start to forget. So you need that you need that information. I'm just going to throw this out there. I had a physical, which I do regularly, and talking with my doctor in Gravelburg, and she said to me, Myrna, do you know you have 6 vertebrae? And I went, nope, I sure don't. And then she's just looking at me and smiling, and we are friends. And then I like, how many are you supposed to have? Like, I have no idea. And she said, like, 5. And I went, well, just, isn't that fucking special? Like, now what? And she said, you know what, nothing, really, nothing. It's not gonna, it's a rare thing. I think she said it was 4% or something. It's not gonna damage me or anything like that. So I feel all special that I have 6 vertebrae. But, so, and I think I'm 53 and nobody's ever told me that before. So when you were saying that about those records, yeah, like that can help with your own health care, right? You know? Okay, so what would I do to make a difference? I think I'm gonna go visit Justin Trudeau. That's where I'm gonna start. No, really, I think this is, I just think PFCC is just such a good thing. Like we're making a great society. Like it's a building block on us as as individuals. But I also understand that nurses are busy and they only have so much time. So I think if you're really busy and you have all these people that are sick and you need all this information, I think that is also difficult. So what would be the change there? You'd have one whole extra staff person that would allow free up time for every patient that was in there, right? That would free that half an hour extra for every single patient that you had in there to make that difference. That's what I would do. Yeah.
So a lot of our themes today talked about accessibility, talked about information sharing, and I think that you know, it speaks to, you're right, patient-family-centered care is really something that can help us to improve the quality of care for our patients and families. And so I just want to end off today just by kind of reinforcing, you know, just really focusing on how can we empower our patients to participate actively in their care, to be knowledgeable and able to make the decisions about their care, and really help us in the healthcare system to manage the work that we're doing, right? With more information, healthcare professionals can do greater things. So just creating those open communication lines, whether it's an electronic health record or whether for now it's verbal, and we have to remember that as patients, just remembering to be open and communicate as much as we can with the professionals and help them to provide the care that they do. So with that, I want to say thank you to everyone for joining us today. We have a few people to provide some closing remarks, so I invite Beth and Ron up, if you would.
Thank you very much. I truly enjoyed the session. And do you want me to stand here? I don't do that. Anyway, thank you to Stacy and Angela and Brenna and Mallory for your enlightening presentation today. I'm a great believer in the patient family-centered care. I think it's part of the health system that is really important, and I can only see it gaining more importance. You know, health is a very complicated system, isn't it? Healthcare, and so I've been a member of this. I've been in the health system for 56 years as a health professional, as a pharmacist, and I still learn every day. My wife's been a nurse for over 50 years. I have a son who's a family physician, and my 16-year-old granddaughter intends to become a doctor as well. So it's part of our family blood. And I'm only 49 years old. but truly, your stories, we thank you for these stories because they're private. And privacy, of course, is a big thing today. But for sharing these with us and also your ideas and how we can improve is very, very gratifying. Thank you. I'm a member of the Health Regional Board of the Regional Health Authority. So Angela, I was really shocked when you said you couldn't gain access to another region. And when I consider the fact that I believe the Rosetown area, the health district there starts on the other side of the river, right? So don't we treat patients from Kyle and Melrose? I don't understand that. So that is something that surprised me. And the information, Stacy, for the pharmacy part, being involved in pharmacy, PIP, which is patient information profiles, can be obtained when you go to your pharmacy if they can access your file. And so perhaps the pharmacy you deal with doesn't have that particular connection.
They do, but they don't use it.
They should use it. And at any rate, I could talk for a long time, as Larry would know. But just to say that I think, in any type of business, and healthcare is a business, I think care, compassion, I've always felt that in my store, greeting that patient as soon as they're there is so important. And being compassionate and caring is part of that's what I believe. I think following up with your patient is important too. We try to do that, and when we're busy as can be, but following up with patients on your antibiotics, even things like that, is very important. So one part of patient care, I think that's important in my field, is knowing how to get information to a patient. For example, anybody who's 65 years and older can get a patient assessment done twice a year. We provide that. Your information is all given, and the pharmacy, you don't have to pay for that service. And then we do what we call a compliance pack, which you can get if you're, taking several drugs in a day. They're always put into a 28, 4 different packages a week. And these are things that some of the patients don't know. So, all these, as I said, healthcare is complicated, and there's always new things that are happening. And so I think it's really important for the pharmacy that you deal with is if you're eligible for that service, you should mention it to them. I happen to have been a patient several times, and I've had just wonderful service at every facility I've been at. I happened to be in Palm Springs a couple of years ago when being that I have some bypasses, I was experiencing not a serious problem, but my wife said, we better go and have it checked out. And they were really good down there. And I think of when I was in the emergency room, which happened to be in a hallway, and I was number 8, if I remember correctly. But the elderly patient beside me, I got over here, and this gentleman didn't speak very good English, and I don't think he really understood. And he hadn't taken his diabetic medication for a month. He maybe couldn't afford it, but the doctor talking to him said, make sure we get this social worker and make sure he gets his medication. But can you imagine not taking his medication for a month? And that does happen because we don't understand the system sometimes, and that's where you people are so important. So thank you again, and continue good luck. Thank you.
So I have the final closing. I didn't introduce myself before. I'm Beth Adashinsky, and I'm the Vice President Performance and Quality for the Cypress Health Region, and I have the distinct pleasure to be the sponsor for the Patient and Family Centered Care program within this facility, within our region. These ladies that we've seen today are courageous, they're giving, they're caring, and without them and without more people like them that are willing to speak up and to help us, and to all our patient and family centered care reps that do that for us on a continual basis, I give you heartfelt thanks from the region, from your senior leadership team here, from everyone, from docs, from the workers, from our staff. You are very, very important to us. And what an absolutely awesome way to start a week that deals with safety. And I thank you all for everything that you've done and giving of yourselves, coming out today. And for those of you out in telehealth land, thank you very much for being a part of this time with us. And we look forward actually to many more, because I think we've actually broken through on the technology, and it might be something that we'll be using more often. So anyway, if you can, please come and take part in the rest of the week with the certain things that are coming on. And a round of applause, please, for all of our reps and the courage that they've shown.